You're watching Shalom TV, celebrating Jewish culture. Funding for Shalom TV has been provided by the following. And by viewers like you.
Jewish Education in Media is pleased to present L'Chaim, a program that highlights the people, issues, and events of importance to the Jewish community. Now here is your host, Rabbi Mark Golub.
I'm Mark Golub, and we're coming to you right now from the headquarters of Bnai Zion in New York, where we do much of our taping. And Bnai Zion does many, many wonderful things, and it's involved with a medical center in Haifa, Israel. And I have the great pleasure of sitting with Dr. Amnon Rofe, who is part of the Bnai Zion Medical Center. And first of all, it is a wonderful pleasure and honor for me to sit with you. Thank you for joining us.
My pleasure.
I want to talk about the hospital. I want to talk about your work there, but I first want to talk for a moment about you. And we talked off camera. There is an irony to the fact that your last name, Rofe, it means doctor, healer in Hebrew. And I asked you whether you knew from birth whether you were going to be a doctor, and you said?
I didn't know for sure, but my father explained it to me.
You were the dream of every Jewish parent, that you grow up and be a good Jewish doctor. Where were you born?
I was born in Israel.
You were a Sabra.
In Bnai Zion Medical Center many years ago.
Is that true?
Yeah.
And you grew up in which city? Were you in Haifa yourself?
All my life in the city of Haifa, which I love very much.
Where are your parents from?
My father originally from Syria, and my mother is 6 generations in Israel. Wow. I'm the 7th, wow. Yes.
I want to make sure I heard you right. Did you say your mother is 6 generations?
Right. I'm the 7th generation from the part of my mother.
How did your mother come to be in what was then Palestine?
They know about 6 generations ago, but maybe they were always there in Israel. There always Jewish population in Israel. It is around the city of Tiberias and Safad.
You know, Amnon, there are many people who still have this notion that the Jews were not there prior to the end of the 19th century, that when the young pioneers of Chalutzim came in the 1880s and 90s and the beginning of the 20th century, there were no Jews there. But the reality is, we were there.
All the time, all the years, yes.
Where were you in 1967?
1967, the War of the 6 Days. I was a soldier.
You were a soldier. Where were you stationed?
I was fighting in Sinai.
Were you? Did it mean the same to you that it meant outside the state of Israel, the extraordinary victory in the 6-Day War?
If you're talking about the attitude or the relationship, if you can call it, between the Jewish community in the United States and Israel, I can feel like, I know that there was a huge difference. There is a difference between before 1967 and after. Unfortunately, nowadays, it has become not very, Israel is not so popular. I'm sorry to say that, but I feel the influence also on the Jewish community in the United States.
You're absolutely right. But I'm wondering whether even for you...
I was young. I was a soldier.
You were too young.
Yes, I was a soldier.
But all of a sudden, you have the old city of Jerusalem. Mm-hmm. Even as a young soldier, maybe you were too young, but did that mean anything to you?
Of course, of course. I remember every single moment of this event, of course, yes.
Did it mean something to your
my
parents?
Son, my brother, older than me, was one of the soldiers that were the first to go into the city. And
really?
He was crying, I remember him, calling me and crying.
So where are you in 1973 in the Yom Kippur War?
You know, yesterday we had an event, very nice event here for the hospital, and we started to talk with another Israeli that lives here in the United States, and I told him, I started to learn medicine after the war of the 6 Days War, I graduated when we had the Yom Kippur War. I became OBGYN, board certified on Lebanon, first Lebanese war. This is our story, you know.
It's interesting how, yes, events are tracked.
Mm-hmm.
Okay, so are you married?
Yes, I'm married, father of 2 children.
Two
One
children.
of them is the gynecologist like me. Yes.
Very lovely. Mazal tov.
Thank you.
Any grandchildren?
Yes, 2. You want me to talk about them? You want me
You're,
to show
you're
you
a good
pictures?
Jewish grandfather. Mazal tov again. That's
Thank you.
lovely. That's
Thank you.
lovely. So tell me about your relationship to Bnai Zion Medical Center. You know, in America, we all know about Hadassah hospitals. But talk about what is unique or what the contribution is made by Bnai Zion Medical Center in Haifa.
I'm the CEO of the
Yes.
hospital, and I joined the hospital almost 12 years ago. Bnai Zion Medical Center is one of 3 hospitals in the city of Haifa. Hadassah is in Jerusalem. It is one of 25 hospitals, general hospitals in Israel, a very good hospital, almost like Bnai Zion Medical Center. We are a hospital of 450 beds, but we started in the hospital was established in 1922 by Hadassah. By Hadassah, it had 36 beds. It was the first Jewish hospital in the city of Haifa, serving the fighting forces for the independence of Israel. We had, during the years, very famous patients like Yitzhak Rabin when he broke his leg, Moshe Dayan. I used to say that he lost his eye in our hospital, but it's better to say that we saved his other eye in the hospital. And later on it became known as the Rothschild Hospital.
The Rothschild Hospital.
Yes, and in 1988 the hospital renamed Bnai Zion, or Bnai Zion Medical Center, honoring this organization, this blessed organization that helped us to build a new wing, the main wing of the hospital.
Does Bnai Zion Medical Center specialize in any aspect of medicine?
We are as many hospitals in Israel, we are a general hospital, but in order to survive, we have point of interest, center of interest in the hospital. So I can say that our urology department is very well known in Israel and abroad. We have, we face the community. We do things that are not exactly a part of a hospital mandate, like Center of Treatment for Sexual Abused Women. We treat them from the very first moment of the event, and we continue to follow up on them for at least 3 years until they go back, sort of, to normal life. And we were the first in the world to do that. There are many centers for sexual abused women, but not centers that continue and help them to go back to life.
Haifa also has had a long history of an Arab-Israeli population. To what extent does the hospital basically treat both Arab, Israeli, and are there ever Palestinians from the West Bank brought to the hospital?
As I mentioned yesterday in my speech, Haifa is an excellent example of coexistence among people from different religion, different origin. 20% of the population of Haifa are not Jewish. Arab Muslims are Christians, Druses. Haifa, by the way, is the center, international center of the Baha'is. The temple
Baha'i religion.
Yes, they're very close to our hospital. And this reflects on the hospital. Around 20% of our staff are Arabs. 20% of the patients are Arabs. During the last war with Lebanon, they fired the city of Haifa, as you know, for 34 days, a rain of rockets. Many of them fell on the Arab parts of the city. We treated around 600 patients. More than 20% of them were Arabs. We live together.
You know, one of the big issues that American Jews are always talking about is whether Israel treats the Arab-Israeli well enough, and that there is a recognition that it's not about complete equality yet, that there is a certain kind of second-class citizenship for many Arab Israelis. To what extent is second-class citizenship, or in any way, when an Arab Israeli comes to the Bnai Zion Medical Center, are they treated differently?
Absolutely not. Absolutely not. But this is very typical in medicine. We treat also terrorists.
You do, don't you?
Of course, you do it, yes. You treat him, you make him feel better, and then you want to kill him, but you don't do it.
Yes. But it is very important for our audience to understand that, as painful as it may be emotionally at times, the staff at your hospital and at virtually any hospital in Israel treats an Arab or even a Palestinian terrorist as an Israeli Jew would be treated.
No doubt, absolutely yes.
Mm-hmm. Now you're
Look,
special.
I have in my hospital heads of departments, 6 or 7 Arabs, and they are very good.
They are heads of departments?
Yes.
Do you remember which departments?
Yes. Surgery, general surgery is the head of the department. He's very well known in Israel. Many patients come.
What's his name?
The name is Matar, Ibrahim Matar. And
He's
he's pro-Israeli, yes, he's pro-Israeli, just like me.
That's interesting. You say he is pro-Israeli.
Absolutely, yes.
In your experience,
Let me tell you something. If I had any suspect that he is not totally pro-Israeli, I wouldn't.
you would not have elevated him to that position.
Of course not.
So all of the Arab Israelis who are heads of the 6 departments that you say that they are heads of, they're there because you have full confidence not only in their medical ability, but their allegiance to the State of Israel?
Yes, yes.
And
I repeat, I know that it's not easy to digest. Haifa is a very, very unique, special example of coexistence. Just like that, coexistence. We go out together. So,
these are your friends.
yes, try to imagine in the Jewish community in the United States, it's almost the same. I'm talking about Haifa, about the city of Haifa.
Why did this happen well in Haifa, and it does not seem to be happening as well in other places in Israel?
In the cities, it happens. If you're asking me about the Arab Muslims that live in the far villages, you might be right. You might be right. You might be right. They might have some kind of neglect.
But are you saying that in some way Haifa proves what is possible in the ideal in terms of coexistence between Arab Israelis and Arabs in general and Israeli Jews?
That's exactly what I say.
All right, come back to medicine.
Okay.
Okay. You said Haifa, but you said the Bnai Zion Medical Center has a specialty in urology.
Not only this. Not only this.
What else?
We have a very, very interesting center to treat children from age of birth until 5 years old with a variety of problems. Children abused sexually or emotionally, children with neurological problems, children with visual problems. We operate kindergarten for blind children in the hospital, children with hearing problems, etc., etc. We opened 2 years ago a new department of premature intensive care unit donated by Bnai Zion Foundation.
Can you explain to our audience what is the Israeli law and what is the Israeli attitude on a woman's right to have an abortion?
It is very free in Israel.
Totally free,
Not
yes.
totally, not totally. You need to have some conditions before that, but actually, practically, if a woman wants to have an abortion, she will have it.
Is it an issue in Israel?
No.
And what about the fact that there is, within certain parts of the Orthodox Jewish community, opposition to to a lax attitude towards abortion? I mean, we should make sure our audience understands the Jewish tradition, no matter how Orthodox you are, requires abortion if the life of the mother is at stake. It's not even a question of a mother's right to choose. You must abort if your life is at stake, if you're a mother. But there are Orthodox communities which feel that the State of Israel has gone too far in making abortion too easy. Do you or your hospital ever confront any problems because of that?
No, no. It is very not common to make an abortion in Israel, but it is easy. You have to go through an examination. You have to have one of the 5 that I don't remember them now, conditions, and it is quite liberal.
Okay. And in America, there's the issue of trimesters and what is permitted in which trimester for a woman in this country. Is there a trimester system in Israel?
Yes. But this is not a religious...
No, it's a medical issue.
Until the first trimester, it is an abortion, kind of an abortion. After that, we call it early labor. But if you have to do it, you do it.
Healthcare in general. In America, it is an enormous issue. How you fund healthcare, the escalating costs of healthcare in this country. To what extent does Israel face similar problems, and could you explain to us how healthcare is provided for in the State of Israel?
It's totally different from Israel. In Israel, every citizen has the full right of full treatment, medical treatment, even if he is not working. We are all insured. The medicine in Israel, the better medicine is the public medicine. The public hospitals. I can tell you that my friends, that when they need really something, they ask me to go to my hospital, not to the private hospital. The average of the medicine in Israel is good. Some places is excellent. But they keep saying, in America, if you don't have money, you're in big trouble. And you can get the worst medicine in the world. But in America, on the same side, you can get the best medicine in the world. You have to pay for it. In Israel, everybody is insured. That's the most important thing. You don't have to pay for it.
Amnon, what level of medicine is practiced in Israel? And again, it's easy to say, oh, it's the greatest. But I'm asking you, as a medical professional, how do you rate the quality of medical care for the average Israeli in the State of Israel?
If you're talking about average,
yes.
Excellent. Average. Excellent.
Average is excellent.
Yes. Yeah. I mean, it is there for everybody. And the doctors and the nurses and everybody in Israel are good. So if you're talking about average in Israel, it is much better than many other places in the world.
Is the Bnai Zion Medical Center a teaching hospital?
Yes. We are affiliated to the School of Medicine of the Technion in Haifa, and we serve as a teaching hospital. You know, we are the first choice of the people in Haifa and northern Israel, and it's not because I say that, because the General Sick Fund, for example, in Israel, on the medical insurance company, they conduct surveys once a year, and at least for the last 10 years, we are the first choice of the people in Israel, in Haifa and northern Israel.
Unfortunately for me, I have spent many moments in a hospital. By the way, it's on the one hand, and I hope you understand what I'm about to say, people who could hear my medical history would say, oh, you poor guy. I say the opposite. Look how lucky I am. no matter what I've had, no matter what's happened to me, and we are all in some way a prisoner of our genetic history.
Right.
No matter what's happened to me, I have been fortunate enough to go to outstanding medical hospitals who have taken care of me, and I am in very good health now. So I feel I am one of the luckiest people. If I were living, maybe a generation ago, maybe I would not have been so lucky, but I am lucky now. So that for me, that's how I look at it. And one of the things that I have experienced is that part of medicine, which is sometimes overlooked, is you need a brilliant doctor. Most all you need a brilliant, and it doesn't matter what his bedside manner is. I want the perfect technician and the perfect diagnostician. Okay. Mm-hmm. But there is a second element that I have found, and I want you to tell me if this resonates with you at all. The nursing care in a hospital is also something that I feel is critical in the success of patients to heal well. And I wanted to know the extent to which nurses in Israel, whether they're male or female, whether nurses are respected within the medical system in Israel, and are they paid appropriately?
Nobody's paid appropriately, okay?
Good for you.
Yeah, but they are very respected. It takes you a few years as a doctor to understand what you just said now, that they are very, very important for the process of healing.
You do agree with me?
Of course, I agree with you. But they're very respected.
There has been traditionally in America, I don't know if it's traditionally worldwide, whether it's ego or whether it's other aspects, there often is tension.
Ego.
It is ego.
Yeah, of course.
A doctor has to learn that a nurse does not really have to threaten their authority or their wisdom, right?
My son started his practice 4 years ago as a gynecologist, OBGYN, delivery room, and I told him, Guy, listen to me. You started today. The nurse knows much better than you. Listen to her. And he told me, I thank you very much every day for this.
That's a wise thing to have said. Good for you. So how is it, Amnon, that the financial system of Israel is not bankrupt from your countries being able to provide health care for everyone, in essence, as part of their citizenship? Why has not medical costs escalated so high that the country can't bear it? That's what we hear in America all the time.
We operate with a very, very low budget in the hospitals, in public hospitals. And that's why I devote part of my time in seeking help and to raise funds in other countries.
So part of your work is fundraising?
Of course, absolutely, yes.
Okay. And you're here in the United States doing that too?
Right.
By the way, Amnon, you come to America often, but this particular trip, what's the specific purpose this time? What are you seeking to achieve?
Because of the situation in the Middle East, with the significant changes in the countries around us, we're sure that the question of next war is not if, but when, and we have to be prepared. We need protected areas in our hospital. We need protected emergency room. We need protected places for at least 200 patients, and we don't have it in the hospital. And we painfully learned from the last war that wars are no more in the far borders, but they are at our home, our backyard. And in the very last day of the last war, with Lebanon, when the UN resolution of the ceasefire was about to be implemented, the last barrage of rockets was fired on the hospital, our hospital. Huge damage to the property, thanks God, not casualties. And from that day, my main goal is to be able to raise the funds necessary to build those protected areas. And now, everybody knows what happens in the countries around us. And we know that in a certain moment, instead of fighting in between them, they will fight against Israel. I have to be prepared. I'm in charge 24/7 on 450 patients and 1,800 employees. And that's why I came here this time, and this is why I will be back here many other times. I approached this also to the Israeli citizens, of course, and I succeeded. I need more money for this.
You are raising money for a very worthy cause, and you are a lovely representative both of the State of Israel and Bnai Zion Medical Center. I hope that many people watching you right now will want to participate in protecting, building your medical center, which does extraordinary work for so many people in the Haifa region and really for the State of Israel as a whole. When you look at some of the things that Israel has done in the medical field, I assume that you as a doctor in Israel have a certain sense of pride that Israel has been at the cutting edge of various aspects of medical science, correct?
Right.
And we always talk about the number of Nobel Prizes that this little state of Israel with this small population has won for the Jewish people in the State of Israel. And we are all so proud. And again, we kidded at the beginning that here your name is Rofe, and the dream of every parent is to have a doctor. You know, in the Jewish tradition, the doctor is in some way seen as an agent of God's presence on earth. Many people think that the first line of medicine is tefillah, is prayer. And the Jewish tradition, Jewish law, Maimonides, goes out of his way to make sure we understand that the first requirement is to seek a competent, qualified physician. Then you worry about prayer. And for me to sit with you and to talk to you about the work you do and the extraordinary leadership you've brought to Bnai Zion Medical Center, I want you to understand what an honor it is for us. And I want you to know you are always welcome here on Shalom TV. And I hope if I get to Israel one day, I can come and visit your medical center.
Please be my guest.
And I would love to bring my wife and see the hospital and really show it to our audience.
I'd be honored.
Toda rabah.
Thank you very much.
And that was my meeting with Dr. Amnon Rofe, who is the CEO of the Bnai Zion Medical Center in Haifa. And if you want to be in touch with Bnai Zion, they have offices here in New York. Their address is 136 East 39th Street, New York, 10016. And you can make a contribution if you'd like to the Bnai Zion Medical Center. And of course, any contribution you make to Bnai Zion Medical Center is tax deductible. As always, I'd love to have any reactions you have to the ideas expressed by Dr. Rofe. Please be in touch with me this week. Email me, write me, post on our Facebook wall, tweet me. I look forward to hearing from you. Until the next time, I'm Mark Golub. Be well, my friends.
L'chaim is a presentation of Jewish education in media.